and gentlemen, welcome to MedSynapse podcast series where we explore the latest innovations in healthcare. I'm your host, Dr. Nigar, and today we're honored to have Dr. Hamidreza in our today's discussion. And today we're honored to engage in a thoughtful discussion with Dr. Hamidreza Rokhsatyazdy, a distinguished neurologist and MD with over 12 years of expertise in adult neurology. Dr. Hamidreza serves as a neurology consultant of Irfan Grant Hospital in Iran and Windsor Medical Center in Dubai. With a wealth of experience in evidence-based and cutting-edge treatments, Dr. Hamidreza specializes in a range of neurological disorders, including headaches, migraines, cluster headaches, Alzheimer's, dementia, stroke, Parkinson's, chronic pain management, cervical and lumbosacral discopathy, tremors, and various neurological conditions. His notable contributions include a published book on awake craniotomy and numerous articles in evidence-based journals. Today, our focus shifts towards exploring innovations in anxiety and depression treatments, delving into the forefront of mental health advancements. Without further delay, let's embark on this enlightening topic with Dr. Hamidreza. Welcome, Doctor.
Hi, thank you for your time, and I hope this discussion would be helpful for your followers and listeners.
Thank you so much for joining us again on our second session on MedSynapse. We're very happy to have you on board with us.
Thank you from the MedSynapse team, and especially you, Dr. Nigar.
Thank you so much, Dr. Hamidreza. Now let's begin with our podcast. Dr. Hamidreza, to begin with, what diagnostic assessments or tests do you recommend for patients who are not responding to conventional antidepressant treatments?
Nowadays, with analyzing the electroencephalography waves, we can understand what is the main causes and what is the main problem in which part of the brain that cause signs and symptoms such as depression or anxiety. With the analysis of the EEG, electroencephalography, it's the abbreviation of the electroencephalography, we get the data that we name it QEEG. Through the waves in different parts of the brain, we can understand if there is any anxiety, depression, or for example drowsiness or other attention deficit in the brain, so we can get the better management and the treatment plan for them. There is also another technique that get evidence-based. With the QEEG analysis result, we can understand who are good responder to drug, who are good responder to the other technology of the treatment for depression and anxiety. For example, TMS or neurofeedback or other techniques such as TDCS, or combination of these therapies. Nowadays, we are trying to find the best way to controlling the signs and symptoms of the psychological disorders such as anxiety, such as depression, such as attention deficit, also in healthy individuals, such as memory problem, also in healthy individuals. With analysis of the QEEG, we will understand which part of the brain works well, which part of the brain doesn't work well. We can enhance the laziest part of the brain to get the better rendezvous and better result and better outcome for using their brains, especially in the youth. Because the youth, they want to take an exam, they want to pass some levels, they want to have a better concentration, and also in the middle age, like us who are in the 40 or 50, they need more use of the power of the brain because they have many kind of disturbance in their life, for example with the family, kids and something like that, but they want to have a concentration, better concentration during their job. So with the analysis of the QEEG, and also there are some online assessment of the concentration, attention, memory, and executive function of the brain, so we can tell them which part of the brain working well, which part is lazy, and how we can induce and enhance the laziest part of the brain, especially in healthy people and also in the people who are diagnosed, for example, like depression or anxiety.
Now, how does this technology-assisted treatment compare to traditional methods in the context of anxiety and depression?
From 2006, the first time FDA give the approval to TMS, transcranial magnetic stimulation machine, for treatment of the depression, the drug-resistant depression patients. After that, this device get many innovations and find many new protocols for controlling the other signs and symptoms of the disease, such as anxiety disorders, OCD, and controlling some kinds of schizophrenia and also migraine headache. Besides the transcranial magnetic stimulation, there is another machine that's named neurofeedback. It's somehow from the signal of the brain, we try to learn the brain how to have a better concentration, how to have a better memory, how to control the emotion better, how to get more balance during the stressful situation. These new kinds of technology, its help, besides the conventional drug therapy and medical therapy that we had, help to get improved better and easier and faster. For example, the patient come and you understand she or he want immediate response to get control their anxiety, for example, for getting the exam or for have a finished their project. These techniques help us to give the immediate response to the patients and to the healthy individual also, to enhance their brain ability, to enhance their brain function, to do their jobs and tasks better. These new technology are safe. They doesn't have any adverse effect. The adverse effects are very simple and we cannot name it adverse effect. It depends on the operator. They are operator dependent. It needs to be done by specialized and expertise. Nobody who has a device can do the best for you. It's not device dependent, it's operational dependent. The operator is very important, who use this device for you, which protocols are selected for you according to your signs and symptoms, QEEG analysis, other test analysis, which protocol is best for you. This needs some expertise and knowledge that need to provide for you the best technique and best device and best protocol. With the conventional and traditional medical treatment, we have many side effects such as weight gain, weight loss, increasing libido, decreased libido, sexual problem, erectile dysfunction in men also, and in women they get anorgasmia. There are many other problems for controlling their signs and symptoms. But with this new device, because they are working locally just on the brain, they do not affect any part of the body. They do not affect any part of the other organs. These techniques, such as neurofeedback and TMS, they don't have any harm to your brain. They do not change your brain. They not invasion or they are bad radiation to your brain. They don't have. This is magnet. Magnet is a safe. We live in the magnet of the earth. The earth has a magnet. We live in the magnet. It's the power of the magnet, the power that we live on it. So it doesn't harm either. We can do MRI. You know better than me, Dr. Nigar. We can do the MRI for the fetus also after third month of the pregnancy. After 21st week, we can do the MRI also for the mother who are pregnant, because it is safe for the fetus and for the pregnant patients also, because the MRI is using magnetic power. The magnet is safe and it doesn't have any adverse effect. like ultrasound. It is safe. So these are the new techniques, neurofeedback, TDCS, and TMS, that we can do for the patients who are get tired from using the medication, who are tired from adverse effect of the medication, who are resistant to the medication, who wants to decrease the medication, and they want to be sure if they decrease their medication, the signs and symptoms didn't come back again. So with this new technology, we can help the patients to get better. Nowadays, AI comes to help us to getting the best protocol and finding the best protocol and best treatment plan for the patients, as I said, with analysis of the QEEG.
Dr. Hamidreza, as you have discussed some of the advantages on the latest treatment technologies, such as a transcranial magnetic stimulation and transcranial direct current stimulations bring, are there any drawbacks or side effects in comparison to standard approaches when we use these treatment methods?
I start from transcranial magnetic stimulation. Magnetic stimulation, because it uses magnet, so we can't use in the persons who have metallic device in their brain or in jaws or in the neck. Who has the metallic device in their brain or their neck, or who are contraindicated for doing MRI, is the same. They can't use this device. Just lately, when the first time it's invited, in the patients who have a seizure history, it may provoke seizures. But nowadays, with these safe protocols, we didn't see any case of seizure because we control the amount of the stimulation, and we have also two protocols in TMS: excitatory, inhibitory. Inhibitory also helps to treating the focal seizures. We use the inhibitory protocol of the TMS for controlling focal point seizure because it inhibits the part that making epileptiform discharge. So TMS, just excitatory protocols, can't be used in the epileptic patient or who have the history of the seizure, but the inhibitory protocols are safe and doesn't have any side effect. I can say they are more safe and more reliable than drugs. And the other part is how to use this device. If you use, for example, inhibitory instead of excitatory, you see the adverse response, you see the bad response. So that's why I said they are very operational dependent, because the operator, the doctors who give you the plan, is very important. For example, if you need to excite left DLPFC, it's a part of the brain, but you inhibit it, you make the signs and symptoms worsen, and vice versa. So it's very important to do by a neurologist or psychologist who is trained using TMS and has a good experience of using TMS, and who are certified for these things. The TDCS also is a safe technique. It doesn't make any seizure also, but it's very weak in the comparison of TMS. It needs more sessions. It takes time for 1 hour, and it's a little bit difficult to use. But TMS, nowadays we have a theta-verse protocols. Previously we do TMS for 14 minutes. Now we do that 14 minutes protocol in just 5 minutes. So it's not very boring sessions. They can move, they can do whatever they want, and they are safe. So these techniques are totally safe, but if you want to get a good result, it needs your expertise to do with the expert and a good device. The device which is have a standard of the CE and FDA, it's very important. So, but totally they are safe techniques. I tell you, maybe if you use it wrongly, if you totally this device is these two devices are very safe if it's used by the expertise and don't have any kinds of huge adverse effect. The adverse effect of these devices are much more less than drugs that conventionally and traditionally used for controlling the symptoms.
Dr. Hamidreza, how about when it comes to cigarette cessation or any addictions or cravings or bad habits? Are TMS useful techniques in these situations?
It's a very great question. Yes, newly the TMS device get the CE and FDA approval for smoking cessation and cigarette cessation. We can trigger the brains and enhance the brain ability to inhibit our bad habit, to control our bad habit like cigarettes and smoking habit like sugar craving, coca craving, chocolate craving. We can control these kinds of craving. We help the patients who are not able to stop themselves and control themselves when they are in the situation of using these materials like a shisha, like a cigarette, like any kinds of addiction, opium addiction, alcohol addiction. So we can help them with enhancing their brain, and we excite the brain to get the power of controlling, to control themselves when they are in the situation of using alcohol or smoking. So these techniques are very, very, very new, and it have a FDA and CE approval. It's approved by the Food and Drug of the America and also European, and it's very safe technique for controlling and cessating these bad habits such as smoking or alcohol or chocolate or coca craving. And also we can controlling some bad manners such as anger, such as impulsivity, such as fighting. We can control the anger. We can with inhibiting the part of the brain that we name it SMA, supplementary motor area, or DMPFC. We inhibit these two parts, and orbitofrontal cortex also. We can controlling the anger, we can decrease the anger, we can decrease the impulsivity, we can give them a good sleep, and they become more calm when they are in the anxiety and stressful situation. Nowadays there are various type of usage of TMS in controlling the signs and symptoms of the disease, and also manners and behaviors.
Now, coming to our final question for the day, Dr. Hamidreza, we would like to know about some of the success stories that have emerged from the latest technologies in anxiety and depression treatment, showcasing their potential impact.
According to latest data that published, we have more than 75% successful rate in the depression, anxiety, OCD, and also migraine headache for controlling the signs and symptoms to with the using the device of the TMS. The main part is case selection, who are good cases for using TMS, and the second part is a good expertise to use which protocol for which patient. We couldn't have a same protocol for all patients. There are different protocols. You must know which part of the brain what to do with enhancing or inhibition of this part, what happened to the patient, and which is the needs of the patient. So evaluation of the patient is very important, but totally we have near 75% successful rate to root according to the latest data and guidelines that are published.
Dr. Hamidreza, we want to express our heartfelt gratitude for your valuable insights and expertise in our discussion today on exploring innovations in anxiety and depression treatments. Your contribution has truly enriched our understanding of the advancements in mental health care. Thank you so much for joining us on this topic. And to our wonderful audience, a big thank you for joining us on our MedSynapse podcast series. Your time and engagement mean the world to us. We hope you found today's conversation enlightening. Thank you so much, and until next time, see you. Goodbye.